Pain is multifactorial. Just because you have a bulging disc or a herniated disc doesn't mean that that's what's causing your pain right now. That might have been from 10 years ago. So why are you putting so much reliance on an MRI?
Welcome to the Movement Driven Podcast with Dr. Greg Goldberger, where we help you bridge the gap between pain and performance. Each week, we'll share strategies, insights, and real-life applications to help you keep moving and stay driven. Now, let's get into this week's episode of the Movement Driven Podcast. Hello, everyone. Welcome back to the Movement Driven Podcast. I'm Dara Sweat, and we've got Dr. Greg Goldberger here. Greg, how are you today?
I'm doing well. How are you, Dara?
I'm doing great. We're going to talk about something that I deal with on a regular basis from being in a car accident and having herniated discs, bulging discs, and all that fun stuff.
Those fun words. Yep.
Yeah.
Let's talk about that a little bit, I think.
We're going to talk about back pain. And I think this is something that a lot of people can relate to. I don't know what the percentage is.
80%.
Yeah, 80, that's a
80% of people have back pain at least one time. And 80% of people that have back pain have repetitive chronic back pain. So we're talking about, I think that puts us at probably about 2/3 of the adult population in the United States of America.
Wow. That is wild. That is wild. So I think today let's talk about some of these back pain myths that are everywhere and clear them up a little bit. So back pain, as we just ironed out here, is one of the most common things. Like a lot of people have that. And it seems like that would be the most common reason people end up in a doctor's office or a PT clinic. So why do you think there are so many myths and misconceptions around it?
I think because everybody has and everybody tries to give their own input and then they confuse everybody else. I think that's part of it. But I think a lot of it is like we're not handling it the right way. People have back pain and then they go and they get a steroid injection or they get a steroid, Medrol dose pack, or they're just told to rest it. And, these are some of the myths that we'll talk about, but we're not doing anything preventatively, at least not on a large scale. And we're not sending people to physical therapy immediately when it happens. Like most of the people that come to me are coming to me after having back pain for months, if not years. They've seen other therapists and other chiropractors and nobody's been able to kind of get them over this. And so I think at some point we have to scream insanity. It's like we have to change what we're doing if it's not working, right? So I think it's a lot. Like we could go into days on that stuff. But like I think part of it is just like if for anybody listening that hasn't seen us or seen somebody like us, like what would you do if you had really bad low back pain? Like who would you call? Where would you go? What would you do? And if you went to your primary care doctor, what would they actually do for you? Oh, rest it. Oh, you want me to give you that injection? Like, why are you asking me? What are you talking about? And do I want you to do it? Maybe not if you're asking me. Let's refer me to the specialist right now. It's messy. I don't like it. But I feel like if you come see us, we can at least point you in the right direction if we're not the ones that can fix it. You know what I mean?
Yeah, for sure. All right. So let's go ahead and jump into some of those common misconceptions. You just mentioned that if you go to a primary care doctor, they're going to tell you to rest it. So it sounds like the myth here is rest is best. What do you have to say about that?
Yeah, especially with the low back. Like, there's certain cases, if you hurt your knee, let's not walk and run right now. But for the low back, a lot of the time, it does worse when you just sit still. If you lay down too long, if you sit, could be so for a lot of people, sitting is the worst thing they can do in terms of what injury they have. Sitting might cause it to actually get worse. So, rest isn't best. I think for the low back, there's a lot of literature out there that says you need to walk. Lots of walking is good. Now, maybe not if you're older and you have something called stenosis. Walking might not be your best friend, but that's another topic for another day. But generally speaking, walking and moving is better because when you have low back pain, the body's first reaction is to guard up and try to protect. And then these muscles are getting tight and stiff and they need to move and they need oxygen and blood flow so that they don't become an additional pain generator in addition to the underlying injury that already occurred. So rest is not best. It has to be active rest. It has to be the right amount of movement, the right type of movement. Do not just sit down for 2 weeks because that is going to make you worse.
Yeah, for sure. So another myth I see out there is that you need imaging, X-rays, MRI to properly treat the back pain. What do you have to say about that?
Yeah, I think people put too much re- reliance on an image, even doctors and other therapists, to their fault. To me, the MRI or the X-ray is just, it's a piece of the assessment. It's just part of the diagnostic puzzle, if you will. When you come in, me just talking to you and getting your history is, believe it or not, maybe 40, 50, 60% of what my assessment includes. I need to know when it happened, how it happened, what makes it worse, what makes it better. All of these tell a story that make the likelihood of XYZ diagnosis more likely or less likely. So when we're asking you these questions, my head's going a million miles a minute trying to figure out what's going on. And then I'm doing a series of tests to confirm this. And then at the end, if you happen to have an MRI, well, now that's good if that MRI lines up with what I've done in my assessment that I've used my skills to look through and to assess. So the MRI is just a piece of the puzzle. And I'll go a step further, and your MRI might say you have damage to a certain tissue. It doesn't mean that damage occurred recently or is causing your pain. Pain is multifactorial. Just because you have a bulging disc or a herniated disc doesn't mean that that's what's causing your pain right now. That might have been from 10 years ago for all you freaking know. So why are you putting so much reliance on an MRI? And then, like, for instance, I've had patients that are getting better. I've been with them for 4 6 weeks. They're getting better steadily, no pain. Hey, doc, we're almost done, right? Oh, by the way, I have that MRI scheduled. Oh, you still going to do it? Yeah, I guess. It's already scheduled. It's paid for. I'll do it. Okay. And then they get the results, and it's like herniated disc, L4, L5, L5, S1, blah, blah, blah. And they start, I was like, hey, doc, I have herniated discs. I'm like, yeah, I know. I know. I told you that. Like, we suspected that based off we talked about that.
Right.
But there's something in the psychology of that, and I totally get it, of where when you see it and it's confirmed and it's for real and it's like, oh, I have this. And that's going to mess with the psyche of, oh, crap. Now my pain's elevated because the image told me it should be. And it's like, well, you were feeling better. And we are like, I knew you had a herniated disc. You just didn't believe me.
Right.
And no fault to your own. Like, I get it, but there's something about the image that doesn't always help the story. Sometimes it's absolutely necessary. And don't get me wrong, it's like, we need MRIs. They're a super useful tool.
For sure.
But it shouldn't always be the first course of action at all.
Yeah. Yeah. I think I had my X-rays and my MRIs just on my lower back, just based off of like needing to check some boxes for car insurance when I got into a car accident when I was 16. Like,
whole nother topic, right?
yeah.
Like,
Yeah.
that's the thing where some people like, oh, I can't get this procedure until I get the MRI. I can't do the MRI until I do the therapy. And like, I actually agree with that. Like, do the therapy first. But then the insurance company, there's sometimes when the therapist can see on an exam, hey, you need an MRI. Like, there's people that will walk in and be like, I don't want to wait. Let's schedule the imaging now. And the insurance company will say, oh, no, they need to do therapy first. It's like, well, based off of my 10 years of expertise and what I've seen, I don't think waiting for a potential, sciatic nerve damage and weakness going down, like, we need the MRI now. What are you talking about?
Right.
And so that's just an instance of the insurance companies having way too much control in today's healthcare system.
Yeah.
But yeah, that happens more than you think. It's
Yeah.
a really bad system for sure.
Yeah, and speaking of the healthcare system and all of that goes into play, another myth that I see often is that spine surgery should be your first line of treatment. So it's like bypass all of the physical therapy that you need. You just need surgery. We need to cut you open. We need to get you on a table. What is really the truth behind that, or instead of, or what's a better path to go, instead of scaring people into thinking that they immediately have to get on the table?
Yeah, I think now people are kind of coming around to like surgery should always be your last, option. Like, let's exhaust every conservative option. Now, that being said, like we just kind of talked about in the previous myth, sometimes somebody comes in and it's like, it's apparent that surgery is going to be needed and it's kind of urgent, if not emergent, right? Like, there are those situations that exist. But I would say for the vast majority of people that come in to see me, even if they've had pain for years, even if they have extreme sciatica, if you don't have weakness and you don't have any like reflexive damage, like we can work through that and do all we can to get you on the other side of that. And if that means you need surgery 5-10 years down the line, so be it. But let's try to prevent that at all costs, right? The other thing is, like, I've treated a lot of people who have spine surgeries, and they come to see me and they're like, yeah, I had surgery, and that was a year ago, and I have the same exact pain I had before the surgery.
Right.
And that's an instance of like, okay, well then that MRI probably lied to you. The MRI that they went in to address something they saw on an MRI and went to go do surgery on it, and that wasn't even the thing that was causing the pain.
Yeah.
And so obviously that's a crazy situation, but it happens more than you think. So yeah, I think just even injections, like kind of going along with this, like injections shouldn't even be your first line. Like if you're in a lot of pain, and sometimes I say, yeah, you need an injection to calm this down. That shouldn't be like option number one on day number 2 of pain, though, you know?
Right. For sure. So, just kind of keeping on these myths and everything. As somebody who my deadlift PR is 266 pounds, which is over 100 pounds more than what I weigh. So that's just a humble brag there. But I believed this myth for a really long time, that deadlifting is bad for your back, especially when I first got into the CrossFit world. My mother and my grandmother were freaking out because they were just like, oh my God, like, Dara, you have herniated discs in your lower back. You can't do this, da, 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 da. And I kind of bought into that for a really long time and stayed away from deadlifts because I was like, oh, well, whatever. But then realizing that, hey, having a strong deadlift is actually helpful in all of these other areas. Right. So from the PT perspective of this myth of deadlift is bad for your back, what are your thoughts on that? And kind of what direction should people go in when they run into this?
Yeah, I think with anything, like, happy mediums are always where we need to stay. Like, there's reasons not to go crazy heavy unless you're training for a specific competition. Like I always remind my patients, like, what are you training for? So like the CrossFitters, like kudos on the PR. Just make sure we're not going crazy high just in the sake of getting PRs, right? Like there needs to be like a common sense stopping point there. But deadlifting in alone, to your point, yeah, if anything, deadlifting is good for your back, with the caveat of when it's done the right way.
For sure.
When it's progressed the right way, when it's coached the right way. And I've seen a lot of coaches and a lot of PTs that don't coach it well and don't coach it the right way. And I think deadlifting, I know deadlifting strengthens glutes, strengthens hamstrings, strengthens core, strengthens low back muscles. Like, so tell me again how that's bad for your back. Here's where it gets bad. When you overload the system and you go into that position, what you are doing is you're putting a tremendous amount of load into your lumbar discs. And so the more pressure you put there, the more potential risk you have for injuries. But you're getting that same load when you're jumping, playing volleyball, and you're getting that same load when you're sitting and doing certain things. Like, maybe not the same load, but you get my point. Like, you're loading your discs all day long. So you can argue that if you're loading it progressively and the right way and with the right timeline and with the right form, then over time you're building your body to be resilient, right? What doesn't kill you makes you stronger. You build over time. And then your system around those discs is better able to take force, so that when you do go outside of, potential injury risk land in a XYZ random activity, your body's able to absorb that force via the muscles and the joints and the tendons and the ligaments, not via the disc that is more at risk of injury. And so to me, it's like, of course, deadlifting is good for your back when done the right way. Now, I will also say, I rarely see deadlifting done the right way. Even people that come see me, I've been CrossFitting for years. My deadlift is this. It's like, well, your mobility sucks on the bottom of it and you're losing form, and that's why you're here for low back pain. So like, Obviously we need to change some things. It's not that we take it away, it's that we make it better. And then we go into, okay, your hamstring length or your hip mobility or your core engagement at this level of your deadlift under this amount of load gives out. So we have to enhance that. And that's how we break down that assessment and get your deadlift better than ever. Oh
yeah, absolutely. Before I started like actually learning how to do a deadlift correctly, I I legitimately thought that you lifted it with your back. Like I thought that was
There you go.
where it was coming
Right.
from, when really,
And
one of
that would
my,
be bad for your back.
for sure. And one of my cues when I'm, triggering in myself, like to lift off, is really I'm trying to drive my heels into the ground and engage, like like you said, your calves and your hamstrings and your glutes and your, like, and it's really lifting with my legs as opposed to lifting with my back. So,
Right.
Kind of learning how to decipher and discern like what that should feel like, and where that pressure, if you will, for me not being a technical term, of doing it, that makes a whole lot of a difference. And when done right, I don't feel pain in my lower back. I do, I'll feel muscle soreness from doing the exercise or whatever, but it's not painful. And I think that I wish that a lot of people knew that and could trigger those movements as opposed to lifting with your back. It's not the same thing as what you're supposed to be doing.
Exactly.
All right. And so I know that I mentioned I have those herniated discs. And this myth is that herniated discs equals doom. And I feel like I am just a testament to that. As I said, I have 2 herniated discs, apparently, supposedly, in my lower back. But I, deadlift 266 pounds. So what is really the truth behind that myth? Obviously, people have to look out for stuff, and there's caution. We're not just saying like, don't worry about anything that an athlete says,
exactly.
but what is, the truth behind it, and to tell people, to let people know that it's not the end of the world. If you have herniated discs, you could still move, and you could still gain, and you could still build. What do you have to say to that?
Well, I think like understanding that what herniated discs are and how common they are kind of puts some minds at ease alone, right? Like I think the problem is when doctors refer to them as like slip discs and bulging discs and these terms that just sound bad. Like and like I don't even know what a slip disc is, to be honest with you. Like slip sounds like it's out of place to me, and it's slipped outside of the vertebral bodies, and we have that's emergent surgery there. Like we have a big issue, but that's not actually happening. So when somebody tells you have a slip disc, they're telling you have a herniation, and it's not as big of a deal as you think it is. Now, can a herniation be quite a big deal for some people and in some situations and lead to the necessity of surgery? Absolutely. Let's not poo-poo the idea that all herniations are no big deal. But for the most part, most people listening to this that are above the age of 50 have a herniated disc right now, right? Like I think in your 20s, I think 30% of the adult population has a herniated disc, and then it's like when he goes up to your 30s, it's like 40% of the population. So by the time you get to like middle age 40s, 50s, you're talking about over half of the population has a herniated disc, if not multiple herniated discs, in their lumbar spine and in their neck. And so like when people come in and like, oh my gosh, doc, I found out I have a herniated disc. I'm like, yeah, I know. Like I would have bet on it just by the numbers of not even knowing anything about you. Just what's your age? Oh, chances are you have a herniated disc.
Right.
And so all that being said is like most times it's not a big issue, and it's something that's probably the most common thing we see in the lumbar spine, I think. And we get over it, and it heals itself just like any other tissue. And can it be more susceptible to re-injury? Potentially, but that's why we rehab it the right way.
Sure, absolutely.
Yeah.
Absolutely. So when somebody comes and tells you, my back went out, I just need to go get an adjustment to put it back in. What does that mean?
We might ruffle some feathers with this one, Dara. So the back goes out thing, I think that's, I don't know where that started, but everybody says it. You know, my dad and my father-in-law say, oh, Greg, my back went out. I'm like, what does that mean? That sounds terrible. Like all of these euphemisms, right? Like, I don't know why we have to exaggerate like this. But I think for most people, when they say their back goes out, it means they're in full-fledged spasm and every little movement they do hurts. And I've been there, and I totally understand what that means. And it feels like my back's out because it's not working for me, and everything I do hurts. So I totally get it. But then I think it goes to really believing something's like out of place. And I think, you know, I've got to be careful with my words here. In the chiropractic world, not maybe new age chiropractic, but old age chiropractic, there was this belief in this term of adjustments and and things are kind of out of place and we need to adjust this back into place. And just from a respectful, different philosophy, I think differently about the spine. I do think adjustments, or what I would refer to as a spinal manipulation, definitely has its purpose and has its place and is absolutely good part of the rehab process. And I do them on my clients, but I don't believe that something is legitimately out of place and needs to be put back in, because if that was the case, then we'd have a legitimate joint dislocation and it'd be a legitimate issue. And that's not something that occurs pretty often in the spine, at least. So I just hate those terms, right? Like, oh, my back went out. Like, let's educate our clients as to what's actually going on, so you have an idea, and not go into these crazy, exaggerated terms that just scare the living bejesus out of people and ramp up their worries and their thoughts, which can have a physical manifestation on their pain. And it actually make their physical pain worse. So like, let's just calm it down. Let's understand that the myth, like back pain is super, super common. But I think a lot of the commonality of the chronic part of back pain is, like we said at the earlier part of this, is like, we're just not doing the right things to address it. Right. And that comes back to like the right type of PT, which I think we're doing here at Movement Driven differently than other people in the industry.
Yeah. Yeah. Well, back pain is just a normal part of aging, isn't it? I mean, is
that the next myth? Is that what we're going to go?
Yeah. Trying a different segue there, Greg.
So like, I think it is like, yeah, so that's a common thing, it's part of getting older. And I think this kind of goes back to the last point. Like, we talk about like the things that we call aging in the back are things like DDD, which is degenerative disc disease, and then DJD, which is degenerative joint disease. And like, why do we have to call it a disease? Like, I get technically it's a disease. I remember learning in medical terminology why they determined a disease. I don't care. The lay person views that as something, they read that on an MRI and it scares the living, I just said it, the living bejesus. Yeah. Like, right. What are all these terms? So anyway, are you going to have things like arthritis and things like discs shrink over time in your body? Yeah, like you do. As you get older, your discs don't have as much fluid and they shrink a little bit. And then that's actually why we get a little shorter. Fun fact, as we get older, that's why, because our posture is poor, because our discs have less fluid. So we lose height. And then what that does is that our joints and our spine then approximate, which then leads to a little bit more arthritic buildup, which can lead to enclosure of some of these spaces where the nerves live, which can lead to more sciatica. Like, there's a domino effect that makes sense with aging. But the people that don't move are the people that have those things versus the people that move. Granted, if you move the wrong way and something goes awry and you have an injury and we have to address it, then that happens. But the people that sit on their couch for 30, 40 years and then come see me, those are the people that have like all the issues. Right. So I think it goes back to what we're saying, is like, just get ahead of it, prevent, get to see a PT, and then understand that how we're generally treating low back pain in this country is not the right way. You should be seeing a PT right away to handle on this.
Yeah. And I think, to kind of close on this point is, physical therapy, what it can actually do for your back pain depends on you. You get personalized movement, personalized strengthening, there's personalized education. What would work for some person might not work for another person. So it's not just a black and white, one size fits all type of thing. And this is why you need to be meeting with somebody or going to PT if you live in the Jacksonville area, preferably movement driven.
Well, to that point there, I think, I probably badmouth my profession a little bit too much, but I think, some people's past experience with physical therapy is not what you just described. And so they're still looking for those answers. And I think, to your point, like why they should select movement driven is because we try to do things based off, like, we need to truly assess you. You're one of one, and let's come up with a plan that's designed for you based off your schedule, your goals, your time, your budget. All of these things come into play. This is the real world. Things aren't in a vacuum. And so we're going to work with you and be your accountability partner, thick and thin, however long that needs to be, based off your schedule and based off your body. So like, yeah, like you can't just go and expect to, hey, go in the corner and do these exercises. I'll see you in 20 minutes. Nobody puts baby in a quarter. What are you talking about?
Yeah, 100%. Yeah, so we don't want pain to limit your life. We want to be able to help you get through that. And the way that you can do that if you're in the Jacksonville area is to schedule an initial eval. We'll set you up with Dr. Greg or Elza. And then you can kind of talk about everything that's going on and get something done personally to you. And you can do that by visiting movementdriven.com. Dr. Greg, is there anything that you'd like to add to wrap up this back pain episode?
I think the summation is like low back pain is scarier than it needs to be. And your number one thing should be move, within reason when you get hurt, and call us, even if you're not local. Like, give me a call and we'll try to find somebody that helps you. Like, we're genuinely cliche in this to help people. So if you're listening to this podcast and you trust us, we're going to find a way to help you wherever you are.
Awesome. Well, thanks, Dr. Greg. Appreciate it.
Thank you.
Next time.
See you guys.
Thanks for tuning in to the Movement Driven Podcast with Dr. Greg Goldberger. Want to see how we're helping people in Jacksonville bridge the gap between pain and performance? Head on over to movementdriven.com. Until next time, keep moving, stay driven.